On today's episode of When Does It End? We will be discussing all things PrEP, a preventative medication that one can take to keep them from acquiring HIV. Today, you will hear the opinions from several people about PrEP and the implications that this drug may have in the future fight against HIV. So, sit back, grab a snack, and prepare to dive into PrEP with us today.
Hi everybody and welcome back. I'm Tori. My pronouns are she, her, and hers. Chris isn't with us this segment, but he'll be back shortly for the next segment. And we're going to talk about one of my favorite topics, which is PrEP. We're going to talk about what PrEP is, what PrEP isn't, who's benefiting from it, who isn't, and why PrEP could be a great option for you. So we're going to have each of our guests introduce themselves, tell you their pronouns, and then we're going to get right to it, okay? So, panelists, would you tell folks who you are and what your pronouns are?
Hi everyone, my name is Pamela Tasson. She, her, hers are my pronouns, and I currently work for the San Francisco Community Health Center, Chicago office, and I serve as the Director of Capacity Building and Organizational Learning.
Welcome, Pamela.
Thank you so much.
Hello, my name is Nathaniel Holly. I'm the Executive Director of the Freelux Project. We're a Dallas-based organization that does stigma reduction services and HIV linkage to care. My pronouns are he, him, and they. And I'm just happy to be here. This is great.
Hello, everyone. My name is Melissa Badowski. I'm a clinical associate professor at the University of Illinois at Chicago, where I'm a clinical pharmacist. We service patients for PrEP, as well as those living with HIV. I do a telehealth program managing patients living with HIV with the Department of Corrections. And my pronouns are she, her, and hers.
Well, wonderful. Welcome to each and every one of you to our regular podcast. So this is going to be interesting because we've not been in the same room with our guests until... So while you have the microphone, so you're a doctor, right?
I'm a doctor of pharmacy.
Doctor of pharmacy, wonderful. I didn't stay in school that long. But if you would you tell us from a medical perspective what PrEP is?
Sure. So PrEP, or pre-exposure prophylaxis, is used for the prevention of HIV. So in this case, it's a medication, and it could be an oral option. It could be taken every day, or now, which is really exciting, is intramuscular preparation. So you can get an injection where you take it once every 2 months.
Things have come a long way.
A long, long way.
Yes. So Nathaniel, as a community member, would you tell us a little bit about... Tell it for folks who don't quite have the same health literacy.
So typically what I tell people when I explain it to them is that this is a pill that you can take if you're not HIV positive that prevents you from becoming HIV positive. It's something that safeguards your cell, that doesn't allow the virus to actually enter into it. And so that's kind of the conversation I typically have with people. This is kind of like a condom that you take instead of use.
Very interesting way to put that, and I love it. So can you tell us a little bit, Pamela, where's the big divide when it comes to PrEP? We hear all of these really interesting things about what PrEP is and what PrEP isn't. We got two different definitions of PrEP. In the communities that you work in, what's the big deal?
Well, it's a big deal because PrEP is really going to help us to stem the tide of HIV. But unfortunately, within African American communities where rates are very high, we unfortunately have not had as much uptake of PrEP as an option as we would have hoped by now. We definitely know that some of the challenges include the lack of promotion, the lack of education, stigma, and there's a lot of distrust and anxiety around anything medical within the African American community. One of the things that really was off-putting is that when we first rolled out the resources for PrEP, Black women in particular weren't being told about it. Even though they were just as indicated for PrEP because of the high rates and prevalence of HIV, in particular in Black women, second to men who have sex with men and transgender women, Black women weren't being told about it. And so we've been playing catch up ever since PrEP was rolled out. And so we're really hoping that more resources will be put behind PrEP and that more Black women will be told about this option for prevention.
Thank you. So while you have the microphone,
Sure.
Can you tell us a little bit about the evolution of PrEP? We heard a little bit about, from the beginning, how marketing wasn't there for Black women, how PrEP wasn't marketed to Black women. So tell us a little bit about the evolution of that. How is it different now than it was at the beginning?
Well, honestly, I'm not seeing them on billboards and the sides of buses and trains, and so that is concerning. One of the things that we know about human behavior, for example, when it's something medical or clinical that's good for me, I want to see that others feel comfortable with that same thing. And so if I don't see it being highly promoted and generated through my community, I may not even feel like it really exists. You know, I talk to people about the field that I'm in and they say, oh, I thought we beat HIV. And I'm just like, I'm really taken aback. And I'm scared because I've been in this field, you know, as a professional for over 20 years and have lost family members, you know, as many of us have. And unfortunately, we're not even keeping pace with the messaging in the community. Back in the day when we had social marketing campaigns, you could see them everywhere. I remember there was one, I think it was Mocha, here in Chicago, and I remember seeing brothers all over the sides of the buses, and I saw 2 buses in the same day within a certain time frame, and they had it down to a science. That's what we do in public health for social marketing. We have it down to a science, but those resources have to be there, and they're not there right now. And this is why our communities don't know that this is an option.
Interesting. So, Nathaniel, resources is a word that I just heard several times coming from family. What are the resources that are there for the communities that you represent? And what are the resources that are needed really to make PrEP a regular standard of care?
I mean, honestly, the resources are here, but there's so many barriers to those resources that disallow a lot of people from accessing those same resources that it's almost as if those resources don't exist at all. So for certain communities, they don't feel comfortable going into certain medical facilities. They don't feel comfortable even going to an HIV provider in their city. And so in terms of like accessing care and accessing quality care that actually has a cultural understanding of the communities that they're going to target, that doesn't exist as widespread as it needs to, honestly. So, you know, in terms of that care, I mean, there's always, you know, your local health department, there's local, you know, community-based organizations, there's local pharmacies that you can go to get all of these things that, you know, PrEP, to get testing, those things. But, you know, in terms of actually getting your mind past that point to actually get in that door, to walk into the door, a lot of people don't have that resource. They don't have that understanding to say, you know, to have that amount of agency for themselves, you know, without having to see the next person take something, without having to have a friend that's experiencing HIV or, you know, in a high-risk situation. They don't necessarily have that. So I think, you know, for me, what I try to provide is a personal touch. I am a person living with HIV. I have been positive for 10 years. And just like you said, I have been experiencing the difference in how, you know, the marketing has been targeted between black men and black women. And I live in Dallas, Texas, and you know, I'm down there like screaming at everyone, you know, to raise an alarm, but nobody is listening, you know, until they can actually see, well, what is HIV? What does it look like? What does a life of someone living with HIV actually look like? What does it feel like to take a pill every day? You know, for some people, that is a hard thing. So when you can actually show them the reality of what it is and educate, you know, groups of people to let them know about these barriers so that they can overcome them, you know, then I think that they can actually engage in the resources that are already available. I just think that it's not targeted enough, and it definitely is not comprehensive enough.
Thank you. So a lot of great pieces of wisdom that we can glean from that. One of the things that I heard you say is that people may not go into a center to get tested for HIV if it has AIDS on the front door.
Yeah. Some people can't even say the word HIV still. They can't say it, they can't look at it, they can't read it. In their mind, if they come that close to it, then it becomes a reality for them. And the reality is, it's already a reality for you. You know, based on the statistics, based on the demographic, based on who you were when you first opened your eyes at birth, it was a part of your life, whether you were positive at that time or not, based on the facts and the statistics. And because of that, I think that, you know, especially for black men, and because we have in black MSMs who have been targeted so much, I think that we owe it to our black sisters to speak up more about the resources that are out here that are available, about the risk of HIV, how you can contract it, how it affects your body, and just continuing to educate our communities about how important it is for us to collaboratively tackle this, because it doesn't just affect affect Black gay men. It doesn't just affect Black women. I mean, it affects Black trans people. It affects us all, honestly. And I don't think that until we really are able to all see ourselves in that fight, we're not going to be able to end it.
Great points, great nuggets there. And if your parents are like our parents, Black, then automatically you're at greater risk for HIV.
Yeah.
Which means that you, simply because of who your parents are, could benefit from PrEP.
Exactly.
Isn't that an interesting way to think about it?
Exactly, but you can't benefit from something that you don't know about.
Good point. Great points. So, would love to ask you another question, if I can.
Absolutely.
Put your medical hat on, all right? So, community hat probably has flowers and stuff on it. Black woman's hat probably has kente cloth on it. Black trans woman's hat probably has pink and blue somewhere in it. So, as a pharmacist, I would love to ask you, what is it that people need to know about PrEP who live in the inner cities?
All right. So within the inner city, I think anyone would benefit from PrEP. And so you all brought up excellent points about who we're not reaching and how do we reach them. So within our community centers, we actually do have HIV clinics, but the word HIV is nowhere on it. It looks like a plain storefront. It's in the areas that are in the highest risk. So I'm in Chicago, and so we have clinics through UIC who are at the north side, south side, east side, west side. So they're all over, and it's just nondescript. So before, you had to have HIV to go into one of our clinics. Now, because of the need, we have expanded it to PrEP options. So that's one way of, advocating for more people to come there. The other thing is, we don't need to have just an HIV or an ID or a sexual health clinic, ID being infectious diseases. This should be offered in primary care clinics. When you go to your doctor's office, any kind of doctor's office, they should be assessing these risks, and they're not. I will wait till the patient brings it up. Nobody should be waiting until the patient is bringing it up. You should be asking it. You should be doing this service for your patients. You're asking them, do you have a temperature today? Does anything hurt you? What's your pain? Are you having sex? Who are you having sex with? Are you planning to become pregnant? What are your sexual practices? So these are all things that need to go into thinking about who we should be offering PrEP. You were talking about resources. Before somebody walks out of our clinical door, so I'm in a clinic, I'm not actually dispensing the medications, I will sit with them, I will educate them, because there are so many things that need to be educated about, how to prevent now other sexually transmitted infections, not just HIV. And so before they walk out of that door, I make sure they have access to PrEP. Do they have a copay? Can they afford it? Because a lot of times a patient will go to that pharmacy and they won't necessarily be denied it, they just can't afford it, and they're too embarrassed to say, I can't pay for this. So I want to navigate, even if it's a $10 copay and I can save them their copay, they could do $10 with something else with that money. And so that's another thing we make sure about. If somebody is undocumented, so within our city, we have a lot of undocumented citizens. We also have a program within Illinois. It's very similar to ADAP, which is that AIDS Drug Assistance Program. It's essentially PrEP-DAP, so that we're able to have access to that. So if you don't have insurance, there's other ways. There's step-up programs sponsored through CDC where you can look up a provider. So my job is making sure that there are resources, that there is access to resource. Inner city, even in the suburbs, a lot of people, that's not talked about. HIV prevention, suburbs, that doesn't exist here. And so it's just making that open to everyone, not just who are we cherry picking who might be able to access PrEP.
Thank you. So, if we could, let's talk a little bit about what resources that are there, things that are there, but also some things that aren't in specific communities, and even more specifically in communities that are being underserved or that are most impacted.
And I'm going to speak specifically about African American communities, but this includes other communities that are in need and highly vulnerable. One of the things that we know, and this is in particular in the South and some of the smaller communities, but also within urban communities, is that a lot of times we do in fact have those resources, but getting access and feeling confident about those resources are very important. And so we know that, for example, and there are studies that talk about this, who's providing those services. And so within the African American community, it's very important. I will say it for myself, even as a patient and client, that I like to be able to see my people providing me with services. And there's nothing wrong with that. So this for us bias concept, I think, is very important within a community that has experienced a lot of medical atrocities over history. And so we know that we've heard this ad nauseum, that there's a lot of distrust, medical mistrust and distrust within the African American community. But what exactly does that mean? Does it mean that if you're just African American, you can provide services and you don't have to be that good? No, that's not what that means. What that means is I want a high quality clinician who just happens to look like me as well. And maybe they went to my school, and maybe they're from my community, and maybe we went to the same college. I have a primary care provider. She reminds me of my mom. She's the same age as my mom, and I love her dearly, and I've been going to her for years. And so that connection, I talked to my clinician about HIV. I told her years ago, I said, aren't you going to ask me about an HIV test? And she says, well, do you need an HIV test? And I says, well, perhaps. I said, but maybe you should start asking me that every time we do my comprehensive, my annual. And sure enough, she was like, okay. Every year, without fail, she would ask me, questions and whatnot, but that was a part of the screening that she did for all of my checkup. So anyway, but it really, I'm excited to go to her because she gets me, she understands me, and we're connected. And sometimes that doesn't happen. With PrEP, oftentimes that doesn't happen. And so you may have someone who's not going to be medically adherent because maybe they didn't get the connection. Maybe they don't feel comfortable going to someone to be prescribed medications. Like I take hypertension medications, which is perfectly fine for me. But I know that there are some African American women who aren't taking their hypertension medications. And this can happen to any of us. But I think that there's something there that we really need to get at. And so it's like that with HIV. It's not that easy of a topic. The resources are in fact there, but how do we get to the point where we feel comfortable, where everything feels normalized? And so PrEP is kind of like, well, but I'm not sick. Why should I take this? That's the thinking. I'm not sick. Why should I take this? However, we're not thinking about STDs until we get one, right? Ta-da! Like, oh yeah. And so, I think the question that we're, public health that we're always working is, how do we help folks to get it? So we have to have ongoing dialogue. We have to talk about not only what resources are out here around PrEP and other resources, supporting services, but also, how do I take a look at my behaviors? Why do I feel that I may need PrEP? Condom use, that's another option. And some folks say, well, I'll just use condoms. No, you're not. A lot of folks are not using them, and they don't talk about that because there's some form of embarrassment around that. Because when that STD pops or HIV pops, like, I didn't use a condom. So we have to have some real conversations. And so one of the things in public health is that, we try to work on different things at the same time. So behavioral change is really important, it's critical. And so we really have available to us ways to have conversations with small groups of individuals and one-on-one. And so those interventions are not being used as much as they should be used in our community. Black folks like to talk. We're very engaging, we're interactive. We need to have conversations and we need to talk. We've got a lot of pain. We have a lot of pain that we're dealing with.
We do.
And so because we know what we know about ourselves and the layers of pain, we got to try and start breaking some of that down, because asking someone to take a medication and they haven't dealt with their pain and just being able to survive, that's a lot. That's a lot to put on a person.
So you and I are both Black women.
Yes, ma'am.
You're a cisgender Black woman.
Yes, I am.
I'm a transgender Black woman.
Yes, ma'am.
That simply means we got to our womanhood by different streets, different pathways. Yeah. But we met here.
Yes.
With that being said, we know as Black women, we can talk about how to prevent a cake from falling in the oven. You don't stop. we can talk. You remember that? Do white women learn that? Yeah, we learn those kinds of things. Those are the kinds of things that as black women we're taught. You're taught, don't put your hand on a hot stove. But what we don't talk, we've never been empowered as black women to talk about healthy sex.
Our parents weren't talking about it. My mother, oh my goodness, no. And her mother, no. Boop.
Yeah. My mom, I remember my mom, my mom was washing my clothes. I'm not going to tell you how old I was because it's none of your business. But my mom was washing my clothes and I was upstairs and my parents were downstairs and she found an empty condom wrapper when she was washing some clothes. And she screamed, there was this guttural scream. And she called me and I ran downstairs and my father was standing there cracking up with the way that I remember, with tears falling down out of his eyes. My father's a big, tall, strapping, 6'3.5" black man who was built like Michael Jordan at that time. And he's there crying, doubled over with laughter. My mom, it's as if the world had ended. And her question was, is this yours? Now, I'm an only child also, so I couldn't say no. So I said yes. And she asked what it was for, and I started to explain, and she stopped me because she didn't want to hear it.
Yeah. It's too much. Mm-hmm.
It was too much. It was too much.
Yeah.
And so what we have to do as black women, as black people, as women, as people, is change the discourse, change the conversation so that all of the folks that we serve and represent and all of the communities that we're a part of understand that healthy sex is good sex. Mm-hmm. And for many of us, healthy sex involves perhaps PrEP as an option. Thank you. Can you tell us a little bit about the folks that you serve and what are some resources that aren't there and what are some that are there?
Sure, especially in terms of PrEP and what I see and how we address the behaviors that we engage in. I think that one of the things that is often overlooked is the mental aspect of wellness. I think a lot of times we leave that outside of the care continuum and how we really want to address health, and that is one of the primary ways that you can actually be in good health is to tackle your mental health. For me, once I was diagnosed with HIV and was going through depression, I started going to counseling and therapy, and what I realized is that HIV was not the root of a lot of my issues. HIV was just a tipping point. It allowed me to see that I had so much more going on underneath that I had never addressed. And the more I talk about my story and the more I encounter other people, they are going through the same thing. It's exactly the same. They have never taken the time to really look back in themselves and go back to that child that was afraid, that was vulnerable in that moment, and where they started to really form how they would be in the world and how they would protect themselves, to go back and hug them and say, it's okay. You don't have to be so afraid. You don't have to be on guard. You don't have to push these things away that are good for you. There's healthy ways to love yourself. You don't have to love yourself the way that those people loved you, because that wasn't the love that you needed. That wasn't the love you were supposed to have. And so you take that love and you give it to yourself when that was never really love in the first place. So going back and unlearning those things, I think, is really important. And so for me, in terms of understanding how PrEP is and to take a pill when you're not really sick and to prevent you from getting sick. I mean, for me, when I'm about to get a cold, like I go get Airborne, I go get vitamin C, I go get orange juice. Because why? Because I feel like something's on the horizon. We have to let people know that this is on the horizon for anybody who is sexually active. And anybody who is sexually active, that means everybody. So, PrEP is not just for gay black men. It's not just for black women. It's not just for one specific group. It's for anyone who is sexually active. And I think that the more we can kind of wrap our minds around that and wrap around, like, it's not just about high-risk individuals, it's about us all collectively, then we can stop separating ourselves so much from the issues when we're not that far apart from it. We're not that separated. And if I could add something additional, in terms of the inherent blood trauma that black people have the there is something to be said about the amount of agency we give ourselves in terms of healthcare. We have been taught not to take care of ourselves. We have been taught to put ourselves second to our work and to so many other things in life, because we were not the priority. Other things always came before us, and so we then internalized that, and we still continue to put other things before us, and it manifests in the data. And we see the data, how it manifests. And so, in terms of how we look at that, no, it has to be a multi-pronged approach. Like you said, in terms of public health, you can never just tackle an issue one way, because it didn't just happen one way. It was a lot of different variables that allowed it to create a perfect storm, to where now you actually have to be strategic with how you handle certain things. And for us, it's about giving people the truth, the honesty, the reality of what things are, and so that they can actually be able to gain that agency for themselves and to ask the questions that they need to ask. What is this going to do to me? What is this going to do for my friend? And how can I suggest this to other people? Or what can I do to get other people on board with this? Like, there are ways we can continue to create this care continuum and connect with other people, but I think we just have to realize that. And one of the best ways to do that, I think, is to incorporate mental health into the conversation.
Powerful. One of the things that I've observed, and I think many of us in our work that we've observed, some of the healthiest young people are people living with HIV.
Yeah, because they were forced to look at themselves.
They were forced and to address their health. Mm-hmm. So I think what we need to really make sure that people can understand is that whether you have, we're not encouraging anybody to go out and get HIV so you can get health care. But what we've established, without saying it yet, is that healthcare needs to be accessible and affordable to every person, so that they don't have to worry about the cost of labs for PrEP, so that they don't have to worry about X, Y, and Z, so that they can have access to mental health services. Doesn't mean that you're crazy.
No. Your mortality shouldn't be important to you when it's challenged. Your mortality should be important to you just from the fact that you woke up today. My mortality became more important to me when I was diagnosed with HIV. I cannot deny that, but it shouldn't have been that way, and it didn't have to be that way. And I've made it not that way for other people because I have lived that experience already. I bear that cross so that you don't have to. I know what it's like, so I know what to go back and tell my former self. No, sister, no, little brother, you can sit down. You need to address some of the ways that you love yourself and the way that you want to be loved. That is the root of how you got into this situation. If you can get back to that, then you can really get back to yourself, the real the person you were supposed to be, not the one that was distorted by your environment, by all these things and the ways that you were taken advantage of. There's an essence inside of you that you can get back to. There's truth, and there's empowerment in that.
It's freedom in that.
It's freedom in that.
Yes, there is. So, thank you. So, I heard you earlier mention more than one type of PrEP, or more than one PrEP modality. Maybe that's the term we should use. Can you tell us a little bit more about that and what works for whom?
Absolutely. So one of the things I do want to take one step back and talk about, you had brought up younger people, adolescents, young adults. This is a huge area in which we're missing the boat on getting PrEP to, because then you start thinking about, oh, well, are my parents going to find out if I'm on PrEP and I'm younger? Just the story you shared with us about the condom wrapper. This is really the people we need to also be spreading that message to. And I think that's a very, very underserved population. And so how can we get that to them? How that notion of okay, you're having sex and this is something that's taboo in your house. It was taboo in your house. It was definitely taboo in my house. And so that's something that, bringing it to the forefront, even when, you have a pediatric visit, if you're going for your wellness visit and you're in school, that is something else that needs to be brought up. But for the types of PrEP and who is it good for? So there's the oral PrEP. In terms of one of the medications, Truvada, in terms of that, that is indicated for everyone. That is indicated for cisgender, transgender, male, female, across the spectrum. But there are other options, such as Descovy, the newer form of tenofovir, that isn't indicated for cisgender females because there's no data there. So it's only in cisgender males, transgender females that it is indicated in. So basically, if you're having vaginal sex, that eliminates that option for you.
If I may respectfully add, it's not for people, it wasn't tested on people who were assigned female at birth.
Absolutely.
Because
that is correct.
transgender people sometimes have
That is true. That is true. The package insert, though, will say that
Yes.
as a vaginal sex, which I wholeheartedly agree needs to change. In terms of then the other option being available now, the new buzz is I can get an injection and I don't have to have that stigma of taking a pill a day or on demand when I think I'm at high risk. So, again, assessing the risk, being honest with ourselves of like, what is our risk factor? That just eliminates a lot of those barriers. But there are barriers to accessing it and implementing it. So in terms of the injectable form, yes, you can receive it every 2 months, but does your insurance cover it? Is it on your insurance formulary? Is there a piece of paper that needs to be filled out before I can access this? There are just so many barriers just to getting it, because it's hard for a pharmacist to get it for patients. Imagine just somebody who's trying to navigate it on their own. And so, I think we talk about side effects. People are scared of side effects with these medications. What we try to say is, if it's the oral option, you might have headache, you might have upset stomach, but it will get better over time. Just stick it out. In terms of the injectable, once we inject it, there's nothing to undo it. But that doesn't mean that there's not options that you can take a oral medication for the first month of it. And so it's optional, but you can do it if you're afraid of, well, will I have a side effect to it? And so if I have a side effect to it, then I don't have to go to the injectable medication. But there are options. Finally, there are options. And so there's so many things that are even on the horizon where something might be every 6 months. It might be an implant. Heck, there might be a vaccine available for HIV prevention in the future. But here and now, we do have different modalities of being able to potentially prevent HIV. It's not relying on a condom. It's not relying on somebody's word that they're in a monogamous relationship and you're the only love of their life. All that happens all too often, but we do finally have choices to provide for patients. And it's not, you're going on this and you're going on this. It's, what do you want to go on? What will fit into your life? And I think that's really important in asking our patients that. Of course, getting them into the door, getting them tested, because you have to have a test showing that you do not have HIV in order to take these medications. But just providing them with options, I think, is the most important thing.
So while you have the microphone, so that was brilliant.
Thank you.
That was absolutely brilliant. And I say it was brilliant. All of you are giving brilliant answers. And I'll tell you why I said that. And I used the word brilliant on purpose. Most of us don't have the opportunities to talk with pharmacists in the way that we're hearing from you. Most people, unless they're part of the Black gay community, don't have opportunities to talk to Black gay men about PrEP like they are with you. And most people don't have the opportunity to talk with Black women about PrEP the way that they have to hear from you today. So I appreciate all that. So very quickly, while you have the microphone, can you tell folks a little about PrEP? Because that's something, even in conversations where we talk about PrEP, we so rarely talk about PrEP as an option to prevent HIV as well.
Absolutely. So that's post-exposure prophylaxis. So you had an encounter. You're not sure if the sexual encounter you had, or even any encounter that you had that may have transmitted HIV, is something that you know the status of that person. And so maybe you do know the status that the person is HIV positive, and you are within this window of time, which is 72 hours. Within 72 hours, you have to be with HIV medication to take this. And so the sooner you start it, the better. But it's unknown if you had that exposure or not. And so it's an actual antiretroviral regimen that you start. So it is 3 medications that you take for 28 days. So there's been a bunch of studies that look at those in the community who finish it. And a lot of people are like, oh, well, maybe my risk wasn't that high. Or again, access or understanding, education. But with post-exposure prophylaxis, if you take it for 28 days, the incidence of developing HIV is virtually none at that point. Again, the sooner you catch it or know about your risk factor, the better it is. There are states actually that you can walk into a pharmacy and you are able to access PrEP and PEP. Illinois, I'm really excited to say, just passed a law like last week saying that you could go into a pharmacy, and so it'll take some time to get there. But I know California, Oregon, and Colorado are the 3 states that allow you to walk into a pharmacy and be able to get a 1 or 2 month supply of PrEP and or PEP.
All right, that's really important. And just a little bit more clarifying information about PEP also. And then I heard you say 28 days twice. You may have said it a third time, but that means that folks have to adhere to
Yes.
28-day regimen, right?
Yeah, absolutely. You have to be adherent. Again, adherence is a whole nother rabbit hole that we could talk about. With PEP, we see patients who will come back for repeat episodes of PEP. That is the prime opportunity to offer, guess what? PrEP. So absolutely with adherence. And to the next, to why we are all here is for PrEP.
Yes, it is. Thank you. That was amazing. So adherence. Can we talk a little bit about adherence? So what's adherence?
Taking your medication as prescribed, making sure that you're doing what you're supposed to do. For me, that's making sure that I take my pill every day. For anybody who's on PrEP, that's making sure that they take their regimen as prescribed by their doctor. A lot of people, sometimes they go on PrEP and they come off of PrEP. Just because you start PrEP at one point doesn't mean you have to take it forever. It just depends on right now. Hey, I might need PrEP, based on what I'm out here doing. It is what it is. Let's just be honest. Like, people
Would you be out here doing having sex?
having condomless sex.
Oh,
Okay, I mean, it just is what it is. So if you're having condomless sex, I mean, PrEP is a wonderful option, and it's something that you can take. It's simple, and for the people that I know that are on it, they enjoy having that ability to affect their health without having to limit themselves in a certain way. Now, that's not to say that you don't still ask your partners about their sexual history or their health history, or that you don't, have agency in terms of how you engage, but it reduces a barrier of fear, in terms of like how they want to engage. And I think that for people that have been diminished sexually for so long, we do deserve an amount of sexual empowerment. We do deserve to know that, we deserve sex, and sex feels good when you have it, and that you deserve to enjoy that, as a human being. One thing that I always understand is that, the church has a huge role for me in terms of how I matriculated and how I developed as a man in society. I do feel like, it takes a village for us to really be able to get this out there and to be able to protect a whole group of people. And I think that for Black people specifically, we have cultural bias towards, certain things dealing with sex because of the church. And I think that if we were allowed to actually say the word sex and say the word HIV and say certain things in church, and they were actually to teach us about our bodies and how, as spiritual beings having a physical experience, we are created for that.
I hear people talk about sex and HIV in church.
Yeah, but they say don't do it. But that's not reality.
Man,
That's
you
not
say
that's not reality. That's not reality.
It is not reality.
Like, I'll be perfectly honest, my first sexual experience was at the age of 12. And that's even before they actually started getting data. So this is 20 years ago, so you even think about the progression and how widely sex is portrayed now. You got to start talking to your kids earlier than that, 8, 7, 9, because they're starting to learn about their bodies. And if you don't teach them about their bodies, somebody else will.
So thank you for that. Thank you. You all are just so powerful, and I love this conversation. Let's talk a little bit about more about adherence. What do Black women need to know about adherence that's going to make PrEP more effective for Black women?
I can use myself as an example. You have to use everything available to you to remind you about self. Your annual checkups, your screenings, taking your medications, because from the time that our feet hit the floor and our eyes open and we start our day, to the time that we hopefully return to a warm, comfortable bed, there's a lot going on. And I think that COVID even sped that up even faster and really got into our heads around, feeling, more in tune with the unknowns and how are things going and what should I be concerned about, and, work and play and family and love and life. And so I know that from my experience, it can take a lot to take one pill every day. And it's not your age, although sometimes it feels like it might be. But a lot of it is we get distracted so easily. I can walk to my hypertension pill and have every intention of taking it right at that moment, and 5 things will happen on my way there. And so those distractions are very common, I will say, in particular for women who are running households. If you have children that you're trying to get off to school, and you have a husband whom you're trying to prepare a meal for, or what have you, I'm speaking my lifestyle from over the years, or if you're trying to get out the door so you can get to work or go run errands, that pill begins to diminish and diminish and diminish. And then 5 o'clock you get home, 6 o'clock you get home, you're like, did I take my pill today? Now those pill packs are very important.
Yes. What are pill packs?
I need some more pill packs. But they have the dates of the week, and some of them have 3 times of the day for each of those days. But they remind you, and you'll know, my pill is still there, I didn't take it. And so we have to use those. And you have the little timers on your cell phone that can remind you, take your pill. Now, sometimes we hit pause or shut up, and then we forget about it that way too. But those pill packs, that's some old school stuff. Those work. There's no lying. There's no denying. That pill is still in that pack.
And so pill packs have the day of the week on them. So if it's Tuesday and you still have a pill for Tuesday, that means you haven't taken your pill on Tuesday.
Some of the easiest, most simplest things will help us. I've gotten in the habit of telling my husband, I need you to remind me too, just like I remind you. He'll remember my stuff before he'll remember his. And that's the same thing we do with our loved ones. We'll remember their stuff before we remember our own. So that's a little bit of family teamwork. Sometimes I'll put a little sticky somewhere that will, on the mirror in the bathroom or on the refrigerator or right there at the door before I go out. I do all types of things because I know that I am subject to forget. And sometimes it's just that basic. I just forget, And then sometimes we get tired of taking medications. If you're taking several, sometimes you get a little weary from that. And so that can be an issue. And then that's a good time to talk with the clinician about, I don't know if we still do this, but taking that break, or maybe reshuffling the schedule a little bit. So there's all kinds of things that we can do to help ourselves. And I also want to say that it's important to talk with our clinicians. Unfortunately, a lot of folks don't feel empowered to have conversations with medical folks. We don't know oftentimes what to say. We don't know how to respond with questions. We may not go in and do our own research, or maybe we've seen some information that's not correct and we don't know that it's not correct, online, or maybe we heard something from a friend. But it's really important for us to engage clinicians and have those conversations because we're supposed to have shared decision making. And a lot of folks don't know about that. They think that, I'm going to go to my doctor. My doctor's going to tell me what to do, and I'm going to leave out, and I'm going to get my medications, and I'm going about my business. No. Shared decision making within your appointment. You have a conversation. You have a two-way conversation every time, and you advocate for yourself. And if you need to bring a family member or a close friend with you to help you to advocate for yourself when you can't, that's what you do. That is so critical.
That is critical. Thank you for bringing that up. So what I'm hearing, and I heard each of you say it in different ways, is that support systems are going to be incredibly important. That your pharmacist could be and should be part of your support system.
That's right.
Sometimes that's a spouse or a partner. Sometimes it's a group of your
Judy's.
I was going to say it, but I didn't want anybody to send a dirty note.
I love it.
All right, but I promise you that was the first thing that came to mind. But that's what a support system is about. The most important thing is that you find a support system that works best for you. And those pill pack things, I think that was brilliant. Because I've been working around HIV for so long. I remember when the HIV medicines used to come. Now, folks get pill packs from their pharmacists, don't they?
Anywhere, for free.
And you just have to ask.
That's one way. There are certain pharmacies that will do all the work for you. It could be pre-fills, and then you pop out the medication, and then you've taken it. It could be once, 3 times a day. The only thing that gets harder is you start adding medications. Well, how do I get this one in there? But your pharmacy will do what is called medication synchronization, and so you can go and once a month it might get delivered to your home. You might go and pick it up, and these pill packs are already nicely made for you. You don't have to do it. You don't have to waste time doing it. Somebody else gets paid to do that. And hey, exactly. And so from that adherence, not every pharmacy will do it, so you have to inquire if they will. But we have found just great success with it. Our patients love it. Sometimes the medications will get sent to our clinic. Patients can pick it up there. So there's just a lot of just different ways to enhance medication adherence.
Wow. But what I also heard you all saying, it requires people to talk. It requires perhaps what some would consider a sharing of power, a redistribution of power. And what that means is each of us has to be empowered to have those types of conversations. That's good. Even your Judies.
Even the Judies. I mean, shoot. When I initially tested positive, the only person that I felt comfortable enough to actually tell was a friend of mine. And so it was actually a year before I actually disclosed to my family and created a support network for myself. So I understand personally how important that is, and to start that conversation, because I think that most people feel so alone and so afraid to even open up about that, or open up about the fact that they have behaviors that they may be embarrassed about, or that they may like things that other people, you may judge them for. But at the end of the day, you have to look at yourself in the mirror. You have to be the one to understand who you are and, what you decide to do in this life. And I think that with all the resources that we have now, and, it's been 10 years since I tested positive. And I remember there was no conversation about PrEP in the Black community 10 years ago. It was maybe 6 months after I got my diagnosis, PrEP was everywhere. Everywhere, all over DC, and so I think that, and then the conversation was, well, I wish we would have known about this. I wish we would have known about it. So having that conversation, starting that conversation among different groups, I think is the most empowering thing that you can do, because that is where all the information is shared. That is where the circle continues, and you're able to push things forward with your group. So, my Judies were definitely my support system, and now it's my family and my friends and my network that I've created, but that only came by me being honest enough with myself to be able to tell my story.
That's good. That's good. And it's powerful, and it also is a lesson to folks. So much of what's missing about PrEP is around messaging. Who is it for? It's for everybody that has sex. Who's benefiting most from PrEP?
Everybody.
Traditionally, has that always been the case?
Well, I mean, I think that the fact that PrEP exists means that everybody can benefit from it. Can benefit from it. Historically, I mean, one thing I do know, Black women have been left out. Most of the groups have been disenfranchised or don't have health equity in this country have been left out of the conversation. I mean, even Black men were a few years behind white gay men, and then we have our Black sisters who are years behind us. And, I think that if we can just tackle the message and say, this is for everybody. Of course, there needs to be targeted approaches in certain communities because of the disparities that exist, but it's for everybody.
That's good. And PrEP became available to the public 2014? 2012. I
10
knew.
years ago.
So I knew the
I was
answer.
diagnosed in 2012.
10 years. I was
Yeah.
like,
Yeah.
2012.
Isn't that interesting? What I would love for us to do is to leave some empowering words for folks who could benefit and will benefit from knowing more about PrEP.
I'll let you start.
And I want you to talk to folks who are like you.
All right. Well, I think for me, I think if I can prevent one infection, I have done my job. in my community, in your community, in our community, if we could just prevent one infection, that's all that matters. And you start small, you start with one, and then you get bigger and bigger and bigger, and then we put an end to this epidemic. It's not going to be, we're going to stop 500 HIV infections. We're going to start with one. And then that one person didn't go out and have sex with 5 other people, and then that's how you start to get bigger. So it doesn't matter if it looks like me, if it talks like me, just one person. Start small with your approach, and that will be very empowering for every community, not just my community.
An empowering word for anybody who's watching this. If you're not on PrEP and you're sexually active, get on PrEP, because it's a way of you loving yourself. For me, my health agency was a way of me loving myself. So the more you take into account who you are and how you are in this world, and your body, your mind, and your soul, the better off that you will be, honestly, in all facets of your life. So whether it's PrEP, whether you're HIV positive and you need to take treatment every day, I mean, you're not alone. That's honestly the biggest thing that I want to tell everybody. You're not alone. There's other people out here experiencing the exact same things that you're experiencing, trying to answer the exact same questions that you're trying to answer. But just know you're not alone, and all the answers will be there for you.
I would say talk about sex. Talk about sex often. My husband and I have been in public health, specifically in HIV, over a couple of decades now, and the kids know, they're getting ready to talk about HIV, they're getting ready to talk about sex, they're getting ready to talk about condoms. So no one in our household could go out that door and say, I don't know. I didn't talk about it. No one brought the subject up with me. I don't know where the resources are. And that's the most that we can really do in our household. And so I always say, talk about sex. Talk about sex with your clinicians, with your pharmacist, with your primary, with everyone. Talk about sex. And leave that conversation open, and be open during those conversations, and allow your family members and friends to be themselves, and for you to be that person they can go to talk about sex.
I love it. Okay, so I will leave you all with this. So I am a Black transgender woman who loves sex. So if you're part of my community, part of my tribe, whichever one of those things you use to describe yourself, and even if you aren't, know that PrEP can be one of those things that helps you to have healthier, which also means better sex. Knowing your status is so important because it gives you the power to make the best decisions for yourself and for your partner and for everybody that you love. Thank you all for being here tonight. Thank you all for being here tonight. Give yourselves a round of applause.
Thank you.
And we'll see you next time. And wait until you see Chris's outfit.